Hi, this is Jeffrey Rabin with your Social Security Minute, brought to you by the law firm of Jeffrey Rabin and Associates. How do you prove a disability case? One of the most common questions we're always asked. And what we tell our clients right away, what you say is never evidence that's going to support a disability claim. It cannot be the sole basis of disability because you want the money. What your partner says, what your spouse says, what your best friend says, what your religious minister says. None of that is evidence that can be solely used to support a disability claim. Social Security disability claims focus on medical charts. The records of your treating doctors are the core evidence that Social Security is going to use when deciding whether or not you're eligible for benefits. Now, the records that we generally focus on are the medical charts from about a year prior to the time you stopped working going forward. Medical records that are older than that are useful for historical context if there's been a bunch of, say, mental health hospitalizations. But those records do not inform Social Security as to how you're functioning today. Remember, Social Security is reading those medical charts to determine what are your symptoms, how do those symptoms impact your function, and how could you still perform in a job on a full-time basis. So make sure that you are completely explaining your symptoms and limitations and frustrations at every doctor visit, because those charts are the key to the disability analysis. And this has been your Social Security Minute, brought to you by the law firm of Jeffrey Rabin and Associates.